To the coronavirus pandemic in our state as the situation continues to get worse. The state confirming nearly 5,000 cases and 6 deaths over the weekend. The rate of positive testing is now close to 10%. After hitting a low of around 3% last month, you can now see the numbers are continuing to rise.
Hospitalizations are also on the rise. There are more than 1,400 COVID patients hospitalized across the state, and that number has doubled over the past month.
Our hope to end this pandemic is the vaccine. Starting today, more people can get a shot. Everyone 50 and older and all adults with a pre-existing condition are now eligible. So if you're eligible, when will you actually be able to get a shot? News 8's Joe LaFurgey is live at the vaccination clinic at DeVos Place with an update now on how it's going there. Joe?
Yeah, it's a question on a lot of minds tonight, Sue and Brian. Unfortunately, they're falling well short of the 20,000 doses they want to administer a day here at DeVos Place. They have the room, they have the people, they just don't have the vaccine. The increase in eligibility has not brought an equal increase in the number of doses being sent to West Michigan. In the case of the mass vaccination clinic at DeVos Place, they're getting more vaccine, but not much more.
We continue to be constrained by supplies. We're seeing a couple of thousand more than we've seen in previous weeks. Working very closely with the MDHHS, with the governor's office to work to increase that even more. Since the DeVos Place clinic opened in January, how many shots they've been able to give has varied drastically. After a steady increase over the first month, weather impacts hurt supply for week 5, followed by a spike in the supply the next week. But once again, last week, vaccinations dipped near 10,000 here, not much higher than we were back in week 1. This week, they expect to give out around 18,000 shots, the most so far, but still far below the 20,000 shot a day goal. So while it's a good idea to get on the list if you qualify for the latest eligibility, don't expect a call right away. As the criteria expand, we are hopeful that that will happen in a more exponential fashion. These last several weeks has been more incremental. It's much the same in Ottawa County, plenty of interest, but not enough vaccine for even those in groups eligible earlier.
When we have appointments filling up in 2 or 3 hours, that kind of tells us there's still a need in that group yet.
Ottawa County is expected to receive just over 3,100 doses this week. That doesn't include supplies to pharmacies and other special providers who get their vaccines from the feds. The advice from Ottawa County health officials: don't just register with them.
We want them to go wherever they can and to not be picky about which vaccines, since they're all very similar in their effectiveness and their safety profiles.
One of the ideas behind the DeVos Place clinic was to show the state how well local health care could collaborate in the effort. The more efficient the setup, the more the state may send West Michigan's way. But that's yet to happen. It does sound like as of the 1st of April that there'll be more J&J vaccines, that the Pfizer vaccine levels will continue as they have been, and hopefully that we see some growth from Moderna as well. Now we have links to the different registries at woodtv.com, and coming up at 7, we're going to show you how Ottawa County is trying to reduce registration frustration. Live in Grand Rapids, Joe LaFurgey, News 8.